Welcome to the DSO Hygienist podcast, where we deep dive into the world of DSO hygiene. I'm your host, Christine Deal. I'm a practicing clinical hygienist with over 30 years of experience. 7 years ago, my private practice was bought by a DSO. I am an advocate for hygienists working in the DSO space. DSOs are transforming the dental landscape. It is predicted that they will be 39% of the industry by 2026. Hygienists play a critical role in a DSO by providing excellent patient care. Discover how DSO hygienists can advance their careers and make a meaningful impact in the field. From career growth opportunities to in-depth discussions on the challenges and triumphs of the DSO hygienist, in this podcast, we will provide exclusive insights, expert interviews, and real stories from passionate hygienists who are making a difference. You won't want to miss a single episode. Our guests will provide clinical guidance, emerging trends, and needed support. Even if you aren't currently in the DSO world, you will benefit from a wide range of topics. Subscribe now to the DSO Hygienist podcast and be part of the conversation. Your journey to happiness and success begins here. Today, our guest is Stephanie Botts. Stephanie Botts has been a clinical dental hygienist for over 16 years. She is a certified ergonomics assessment specialist, providing both in-office and virtual ergonomics consulting and coaching to dental professionals through her company, Polished Posture. She also provides CEs to dental and dental hygiene associations on the topic of ergonomics. Her experience as a clinical dental hygienist and ergonomics expert has allowed her to recognize the unique challenges of practicing pain-free in the dental setting. Stephanie believes that by learning effective strategies to optimize proper ergonomics both inside and outside the operatory, dental professionals can practice pain-free and ensure career longevity. Welcome, Stephanie. I am super excited to have you because you are super adorable. I love your Instagram. It makes me laugh all the time.
Hi, Christine. Thank you for having me. I was so excited to just be a guest on your podcast. I love your podcast, by the way, and what you're doing for hygienists. So thank you. And thank you for the Instagram compliment. I appreciate it.
For sure. And I love your podcast too. So it's so great that we're sharing this information. I want to start by asking you some questions. Let's just get right to it. What are the most common ergonomic issues dental hygienists face, and how do we address them?
I would say, so I've done a lot of assessments up until this point. I do individual assessments of dental workers. And I would say for hygienists, the two most common things I see is the chicken wing, which we're all familiar with that, the arm being abducted out to the side, and then something called forward head position. And this isn't limited to just hygienists. Honestly, it's an issue for everyone because of things like cell phones and laptops. But in dentistry, we're hunched over our patients with our head being forward. And that can actually be pretty damaging to the neck and the back, and it is not comfortable either. So those are the two main things that I really coach people on.
I'm definitely guilty of that. Can you explain the importance of the proper posture and positioning in our dental hygiene practice?
I mean, posture is huge. And if we think about everything we do as hygienists, all of the sexy stuff like lasers and giving injections and doing scaling and root planing or air polishing or whatever it is, we cannot do that stuff if we don't have good posture. I mean, we can, but we're not going to feel good at the end of the day. So posture and ergonomics really is the foundation of our practice. And I don't think this is given enough attention either in school or outside of school. And that's why we see so many issues today as far as pain and people leaving the operatory and just being miserable. So ergonomics is key.
Yeah. What are some strategies for preventing musculoskeletal injuries in the dental hygiene profession?
There are so many aspects to this, and I have really my approach to ergonomics has really evolved since I first started teaching this just a few years ago. And yes, our posture and our movements and the equipment that we're using in the operatory is very important. But I teach things that are beyond the operatory now, like breathing techniques, diet, exercise, stretching, strengthening is huge. That's something that we kind of forget about too. But our muscles, especially these tiny little muscles in our shoulder and our neck and our low back, they've got to be strong enough in order to support us in neutral posture and having good ergonomics. So it's really multifaceted. But I would say if someone is just starting out and really wants to learn, I would say the two most important things for someone to master is operator positioning as far as neutral posture and getting their clock positions correct, and then positioning the patient. If we get those two things, if we get those really nailed in, we're going to be in pretty good shape.
Got it. How do you recommend that we adjust our dental equipment or our tools to promote better ergonomics?
So it starts with posture, and that's really our neutral posture, I should say. That's our benchmark. So once we learn what neutral posture is, what it feels like, and I'll talk about that here in a second. Once we learn what that is and what it feels like, then we need to adjust everything in our operatory to support us in that neutral posture, meaning our patient chair, our stool, our instruments, our ultrasonic, making sure everything is nice and close to us to prevent reaching. That's really what we want to do. So I recommend when someone goes into the operatory, don't just start going ham and working on the patient. We need to take a second and establish neutral posture. So when you sit on your stool, you want to make sure that your hips are above your knees. You want to make sure your feet are flat on the floor. You want your arms close to your sides with the elbows bent at about 90 degrees. I'm giving you a crash course in neutral posture right now. And then you want your head so that you want your head back. That's to prevent that forward head position or that text neck that a lot of people are in. You want to move the head back so that the ear is in line with the shoulder. So I have photos of neutral posture. This is kind of hard just to listen to on a podcast. But I do have photos of neutral posture on my Instagram page, exactly how you should be positioned. And once you're in that neutral posture, then you can be like, okay, this is where I need my patient. I need my patient's mouth low enough so that I'm not out in chicken wing. So I'm not having my head forward. I want to make sure all of my equipment and my instruments, my bracket table, whatever it is nice and close to me. So I'm not reaching, so I'm not twisting. But it really starts with that neutral posture. We have to do that first and then adjust everything else after that.
Yeah. And we all have those patients who, I can't lean back too far.
Yep, we do. And I have no scientific basis for what I'm about to say. It's just something I've noticed. I've been practicing for 16 years. And I think that when we don't have our patient's head supported, either with the headrest or with using some kind of cushion, and we start to tip them back, that's when they start to they're scared, it's uncomfortable. And when their head is not supported and we start to tip them back, they feel like they're going to hurt their neck. The head is really heavy, it's like 13 pounds or something. And so if it's not supported, that can feel very jarring to the patient. So I really encourage people to use cushions. I have special patient positioning cushions that supports the patient's head. And then when they start to go back, they don't have that fear. Their neck is supported, their head is supported, and they will go back much further than you ever thought they would. So yes, there are still some patients who legit cannot lean back in the chair because of medical reasons, but there's a lot of them that they just don't want to. And there's things that we can do to get around that.
That's great advice. How do you recommend, or do you recommend any specific exercises or stretches for maintaining good posture and preventing strain?
Yes. And that's something too. I have a whole highlight on my Instagram called micro breaks. And I designed that because in dentistry, these aren't just random stretches that I'm throwing out there. We overuse certain muscles in our body in dentistry. It's all of us. It's hygienists, dentists, assistants, even front office. And so I designed micro breaks to target those muscles. So the first one is our upper traps. These muscles are the most overworked muscle in all of dental clinicians because we've got our shoulders raised up to our ears, we've got our arms out to our sides, our heads forward, and it all contracts the trap. So I have a micro break for that. I have a micro break for the muscles in the forearm. because we're holding on to things all day long. We're gripping things constantly, and that can cause a lot of fatigue and strain in the forearm, but then it affects the wrist and the elbow up to the neck. And then I have stretches for the wrist. I have a low back stretch. I have one, I haven't released it yet, but I will. The piriformis, the a butt muscle, because we're like sitting all day long. So I think it's very important to do these micro breaks. And what I recommend is you're not holding the stretch for like a second or two, which is what I used to do. I'd think that I was like quote unquote stretching. I was just holding it for a second and then I would get back to work. What I recommend is literally putting your stuff down, taking a stretch for at least 20 seconds. That allows the blood to kind of flow back into those muscles and heal some of the damage. Plus, it just feels really good. And I recommend taking a micro break every 20 minutes. And some people don't. Some people, I get resistance to this, I'll tell you that, because they're like, what, I have to do it in front of my patient? And it's like, well, yeah. But that's really going to help reduce the pain and fatigue in the muscles. And if people are, not confident doing it in front of their patient, they could just, scooch up to the head of the patient, say you're going to put something into the computer real quick. Like they don't know, they're not paying attention. And then you can take a stretch. The flip side to that is strengthening. And that's something that I think that we forget in dentistry. We've got a tight neck, like a trap or tight back or something, and we think we need to stretch. A lot of times we need to strengthen. Those muscles are tired and weak and sore because they are not strong enough, and we're demanding a lot of them during the day. And so I really try to preach strengthening those muscles as well.
I love that. Love that. Micro stretching. I love that.
And it's good for computer work too.
Oh, I'm sure.
Computer work is really hard. Yeah.
Mm-hmm. So how do you educate dental hygienists about ergonomic principles and practices?
I try to attack it from a bunch of different fronts, I guess. Social media has been huge. It's a really good, it's been a great outlet for me, not just to provide education, but also I have just found that I really like entertaining people and making people laugh. Our jobs are very hard and serious and sometimes draining. And so I just like to provide some kind of, just relief at the end of the day with a silly video. Typically, I do try to tie in some kind of education in there as well, but that's been a really good outlet. I also have, and it's no cost for people, which is great. I also have a newsletter. I've just started a podcast. I do a lot of CE. I travel often and give ergonomic lectures. I do webinars. Blog posts. So it's kind of all over the place, but, our YouTube channel I just started, it's very small. It's really interesting growing something from scratch again. It's humbling, but, I'm just trying to go where people are and just teach them as much as I can.
Yeah. So in your experience, what are some of the misconceptions about ergonomics and hygiene, and how do we debunk them?
Yeah, there's a lot. I would say the main one is that people accept pain as a normal part of their life when they're in dentistry. And that is a huge, it's not true. Like we shouldn't accept that. Pain is not normal. Pain is a message that our body's sending us that something's wrong. And we shouldn't accept that as something normal. It does not have to be that way. We need to go back to the basics, learn ergonomics, learn posture, invest in really good equipment, and don't accept pain as your normal. That's something that gets worse over time. And it not only affects your physical health, but your mental health as well. I had an injury that's what drove me to learn ergonomics and to eventually do what I'm doing now. But it affected every aspect of my life and I was miserable, and you don't have to live that way. I would say too, that, another misconception is neutral posture is not possible in the operatory. And I would say sometimes, no, it's not. There are going to be some times where we have to twist or we have to lean, especially if we've got an 80-year-old patient that comes in with COPD and cannot lean back in the chair. No, we can't have neutral posture in that position. But it is possible, I would say 80-90% of the time, with good body awareness, using a good stool or standing, and using really good loops. But I just want people to just be curious and think about what's possible and try to get past these self-limiting beliefs that a lot of us have, because it is possible and you don't have to live in pain.
That's a great message, Stephanie. Can you discuss the role of ergonomics in improving productivity and efficiency in dental hygiene practice?
Yes, I can. So if you are in neutral posture, you're going to have so much more force. I mean, I feel this when I still practice sometimes, and I feel this when I'm doing scaling and root planing. If I'm not in neutral posture, it takes so much more work for me to remove that tenacious calculus than if I take a second, get back into neutral. I have so much more power. Also, going back to instruments, if your instruments are sharp, you're going to be much more efficient that way. When you are constantly reaching or twisting or leaning, that's really hard on the body and it's wasted energy. And so you're using all of this energy to do things that aren't necessary. And so you're going to get a lot more tired, a lot more fatigued. You're going to feel like crap at the end of the day. And if a hygienist maybe wants to do accelerated hygiene, maybe work with an assistant, you've got to have good ergonomics to do that, to make sure that you have the stamina during the day. And plus, production is huge for hygienists. If we want to, especially if you're commission based, you can make a good amount of money, but if you're not taking care of yourself, you're not going to be able to keep up with it.
Yeah, not long term anyhow.
You're right. Yeah.
So are there emerging technologies or innovations in ergonomics that you believe will benefit the dental hygienist?
Yeah, there's a few things, and it ranges from behavioral to equipment. I'm not the only one that is out here talking about ergonomics. I feel like more and more people are doing it, which is great. And I think access to getting an assessment, I honestly think that everyone should get at least one assessment, because you don't know what you're doing. When you're in the operatory, your focus is on the patient. So it's really nice to have someone like me or someone else that does assessments look at you and give you some feedback. I mean, I've had clinicians that had no idea that their legs were crossed the entire time, or that they twisted 50 or 60 times during 1 hour. They had no idea. So I think that's a good thing. And then there's equipment out there too. I mean, we've got cordless polishers. We have truly ergonomic loops. I'm very sorry to say not all loops are ergonomic. It's true, but they have some really good loops now. Things like saddle stools, different instruments. I mean, it's wide ranging, but it does take the knowledge of knowing what's out there, knowing what's good or bad, and then just making the investment. It is an investment. I mean, yeah, it would be nice if our office would pay for things for us, but I don't think it should be expected for us to have our office to buy us things like loops and stools. So it is an investment, but it's an investment in your health and your longevity, and there's nothing better than that.
Yeah, and in your career for sure.
Yeah.
What advice would you give hygienists that are experiencing discomfort or pain in their work environment?
I would say first off is get an assessment. I've had clinicians who have had like debilitating low back pain or tennis elbow or wrist pain or whatever. And it's a simple change of like holding their mirror differently, or getting a different stool, or getting a voice activated perio charting system so they're not twisting a million times a day. So that's where I would start. But for some people, they have experienced an injury and they need to get some help as far as like a PT or chiropractor or acupuncture or whatever. And so it just kind of depends, I guess, on the severity of the injury. But if we can knock it out with just some habit change in the operatory and save you a lot of money from going to a PT or a chiropractor, that's where we should start, I think.
Yeah. And I know my chiropractor loves me.
I bet. Mine used to love me too.
Right. So, Stephanie, can you tell our audience a little bit about how they could get a hold of you and, how they can interact with you on social media and fun stuff like that? I'd love to hear.
Sure. I would say probably the most centralized location where all of my links is on my website. It's polishedposture.net. I'm also very active on Instagram, and my tag is at steph.polishedposture, but people can DM me through Instagram. They can message me through my website. I'm very responsive. I love hearing from people, and if I can help them at all, I would love to.
Well, thanks so much. We will have all of Stephanie's information in our comment section for her podcast as well, so you can get a hold of her. I really want to thank you for coming on today and sharing some valuable time. There's so many great things that you said that I think we could all benefit from. So thanks again for being on today, Stephanie.
Thank you, Christine, and thanks to everyone for listening too.
Thank you for listening to the DSO Hygienist podcast. Please follow or subscribe to be alerted of new episodes.